Hey everyone, what's up? It's Dr. Charlie Johnson, physical therapist here. On this video, I want to answer a question I recently got. Went something like this. Hey, Dr. Charlie, how can I tell if a pinched nerve is causing my sciatica and what do I do about it? So to clear up any confusion around this topic, I want to let you in on a couple different types of sciatica and how you can test to see what type of sciatica you're most likely dealing with, as well as where you should focus your efforts when it comes to the treatment and recovery of your sciatica. Also, I want to help you answer this question and put your mind at ease by teaching you what you need to know about sciatica and how to do some basic detective work to figure out if your nerve is in fact pinched or not pinched. So be sure to watch to the end because I'm going to share with you exactly where I focus my efforts when helping people with sciatica and where you should focus yours too. And in case you're new to this channel, again, hi everyone, my name is Dr. Charlie Johnson. I am a doctor of physical therapy and an orthopedic board specialist, and I help people with back, butt, and sciatica problems heal naturally by teaching them how to use movement as medicine. Be sure to hit the subscribe button as well as the bell for notifications when I post new content every single week if you want to learn how to fix yourself and fix yourself naturally so you don't need pill shots or surgery. All right, so let's dive right into it. All right, so how do you tell if you have a pinched sciatic nerve? Basically, how do you tell what the heck is causing your sciatic nerve to be so aggravated? So how do you tell? What do you need to know? And what do you do about it when you sort of figure that out? So just get that sciatic is a broad term used to describe a problem with the sciatic nerve. People with sciatica have pain and limitation doing many different things in life, as you probably figured out, but specifically doing this motion on their painful side and sometimes even on their non-painful side. So we call this a straight leg raise. If you haven't already grabbed a free copy of my DIY diagnostic guide that helps you understand all potential causes of sciatica and pain in the back, butt, and leg, then please do that. I will include a link above. But basically, this test, let's just say you do this test because your right leg has the pain, numbness, tingling, and you have no problem. Like it's like comparable to the other side and everything is good to go. There's no issue or limitation with it. It doesn't reproduce your sciatica type problem. Then we can be 90% or more sure that you do not have sciatica. So this straight leg raise test is really good at screening and picking up on any sensitivity of the sciatic nerve. So if you haven't already, again, go download that guide and or test this out. So the point is, though, is that sciatica is a motion-based problem. It can be reproduced with motion. So this is super important. I'm not going to dive into it this second, but there will be more on this if you stay tuned later. And this plays into how we treat it. Oftentimes with people, people with sciatica have been told or led to believe that they have a pinched sciatic nerve. So if you have sciatica, maybe you think of it in your brain as something compressing or pinching the nerve. So I want to clear up any confusion here because most of the time it's not due to a pinched nerve. So because of this, right, they travel down a path to decompress the sciatic nerve or unpinch it. So there's expensive decompression programs out there. A lot of people go, they buy inversion tables, right? And it sort of makes logical sense. You try to hang from a pull-up bar, things like that. And look, if they're helping, great. But they're often not helping because your nerve is compressed and needs decompression. But a lot of times if they believe they have a pinched nerve or they've been shown an MRI that shows a pinched nerve, they head down a treatment path to unpinch it. And they ask me questions like this. So, Dr. Charlie, if I have a pinched nerve, how can you unpinch it? You're not a surgeon, right? If my disc is herniated, which is the #1 cause of sciatica, how can we get it to go back in place? There's a lot of treatments that talk about pushing the disc material back in place. Hey, I have an inversion table, or maybe I want to try decompression. Is that something I should give a go or I should try? And look, they're all valid questions, but they all stem from the belief that sciatica equals a pinched nerve, and again, it somehow needs decompressing. But the truth is, most people who have sciatica don't have a nerve that's pinched at all. In fact, it's actually the opposite in most cases. So we're going to chat about that in a moment. So real fast, some good news to put your mind at ease because you're probably wondering as you have searing pain in your leg and you're getting frustrated looking around and seeing all the potential causes of sciatica and you're not sure what the heck's going on, you might be wondering, do I need surgery? So good news, again, 97% of folks with sciatica, which is the number one cause being due to a disc herniation, recover without surgery. So we did a study, it actually came out in 2021. So just recently, I think September, at the time of shooting this video, like a couple months ago. And the goal was to compare surgical versus non-surgical treatment for folks with disc herniations and sciatica. And this is a huge number of people, a huge study. We call it a retrospective study. We looked at data between 2007 and 2017, essentially 278,000 records of adult people with disc herniations. What we found, the results show that 97% recovered without surgery, only 3% needed surgery. So basically, at the end of the day, look, the overwhelming majority of people do not need surgery to fix these problems, no matter what you've been led to believe. Just time, education, and motion. Pretty cool. So if your mind was headed in that deep, dark direction, your disc is bulged or herniated beyond repair, then hold your horses, right? Pull your mind out of the gutter. Chances are very high that you'll do just fine without it. So look, it's still useful to clear up any confusion around, sciatica, what questions you may have, what it is, what you've got going on, despite the fact that, you're probably not going to need surgery. So you can sleep better at night and feel confident in understanding what's likely going on. And this is important because your mind, what you believe, what you think becomes, sort of what you manifest or what happens. So it's going to impact how you heal just as much, if not more, than your physical body and what you do with it. So look, if you believe that your nerve is pinched without actually knowing what it is, or if it's actually true, right, and that you need surgery to unpinch it, then you're probably right. So when we look at a lot of the evidence around, how people respond to certain treatments, one of the biggest predictors of whether or not people will get better with chiropractic manipulation or massage or PT or surgery or things like that is the belief that that treatment will help them. So the belief is very powerful. All right. So look, I'd hate to see you get in your own way of healing and head down a path of treatment, surgery, injections, things like that, that isn't needed if at all possible. So the goal of what I'm going to teach you here in a moment is to educate you and put your mind at ease, right? Number two, break any beliefs that you are broken, things are pinched, you need decompressing or some type of fixing. And then finally, my goal is to empower you and help you understand what you can do about your issue, to put you in control, right? So let's get into it. So again, sciatica is just a term to describe something wrong with the sciatic nerve. It doesn't tell us what's causing it, just that something, funky is happening with the nerve. But clinically, so when people come into sort of the office, if you will, you're examining someone at a Christmas party, it doesn't matter, all right? When you're in person with somebody, sciatica presents two different ways. And there are sort of two, these aren't sort of official types of sciatica, but in my experience, you could take sciatica, pain with a straight leg raise, right? Nerve pain, numbness, tingling, usually worse in the legs and in the back. And then you can branch it and you can say, do they have this type of sciatica or this type of sciatica? So we're going to clear that up, right? So there's sort of two types of sciatica if you want to think of it like that. So again, regardless of which type of sciatica you have, chances are you won't need surgery, but knowing which type will help you understand what you need to look out for, what you need to keep an eye on in case you are one of those people who might need it, and how you might go about finding relief. So here they are. So here are the two types, right? So one type is an unhealthy sciatic nerve, and the other type is an angry sciatic nerve. All right, so which type of nerve problem do you have? First things first, we're going to talk about an unhealthy sciatic nerve. All right, so let's make this super simple. When you feel unhealthy or unwell, do you move faster or slower? Does your sense of taste and smell heighten, or does everything seem just kind of blah and bland? So if you respond how most people do when they're not feeling well, your body doesn't want to move as fast, right? You slow down, your senses become dampened. And the same thing with a sciatic nerve that is unhealthy. So one type of sciatica you could be dealing with is one where your nerve is physically unwell, unhealthy. And in this case, the nerve may be experiencing some type of compression due to swelling or another structure. This would be sort of the pinched nerve category. All right, so you want to think of sciatic nerve, the sciatic nerve at a micro level, sort of like a highway. So this is a game I used to play. You can see it's Frogger. So you've got all those lanes on the highway. Sort of think of that roadway and all those lanes as the sciatic nerve. But instead of traffic flowing down it, you've got information such as feeling to the skin and movement to the muscles being transported from your back down your leg. So again, here's sort of that highway, if you will. And notice with the green arrows, just like, you're looking at a traffic pattern on the, the news or the Weather Channel. Weather Channel? I don't think they have traffic on there. Whatever. Okay. Some news channel. All right. You see that's a healthy nerve. So all lanes are in green, like good to go. There's no traffic. There's no roadblocks. So in this case, of a healthy nerve, feeling and strength are normal. All the signals are flying down at normal rates. Nerve conduction, basically how well, again, the signals are traveling, how fast they're traveling from point A to point B, wherever that may be, is normal, right? Sensation, that's just like the little hot red skin picture there, and then muscle. So nerves carry information such as feeling, the skin, and movement to the muscles. But an unhealthy nerve, you can see here, look at the lanes. A couple of those lanes are closed, right? So everything's good up to that point. Then you've got something going on, something pinching it or compressing it or placing pressure on it. And beyond that point, sort of like a traffic jam or an accident would cause, you see slowing of signal. So an unhealthy nerve, there's some form of compression along the nerve, which leads to closure of the lanes, right? At least temporarily. And this prevents nerve signals of feeling and movement, that information going down, right, from getting to its target. So while I don't love the term, one could argue that this nerve is being pinched. And pinch sounds kind of like permanent, but again, as swelling reduces, as we can move your body in different ways, we can unpinch it in, again, the majority of cases, 97%. So because this nerve begins to lose function, so no MRI or nerve tests are needed because we can test the function of the nerve, not against MRIs, nerve tests, things like that. It's just, why do it when it's very obvious and we can actually do it without having that? So if we know that nerves send information such as feeling or sensation, right, and movement, strength, then we can test each of these things individually to make sure they're good. So let's talk about feeling or sensations first. So sciatica commonly causes weird feelings, right? So if you're having sciatica, you may say, hey, it feels hot, it feels cold, it feels like water's trickling down my leg, it feels like ants are crawling around on it, or it may feel burning, electric-like tingly, it may feel like the circulation's being cut off, or maybe intensified, whatever. More circulation, feels full, swollen. These are normal. So these are completely normal when dealing with sciatica. So the difference is that some folks with sciatica will actually lose their ability to feel. We're not talking just funky feelings, right? So weird funky feelings are one thing, but true loss of feeling that is not changeable with motion, it's just kind of there, like, hey, my foot's been numb for like days, right? That is different, true numbness. So the sciatic nerve is made up of several nerve branches. So it's helpful to have kind of like a really high level of overview of anatomy, if you will. So there's sort of 5 bones in lower back, and you have different nerves that come out between them. The sciatic nerve is made up of several kind of those nerve branches, L4, L5, S1, S2, and then they come together and they go down the leg all the way down to the foot. So the most common sciatic nerve issues, sort of in this order, impact the L5, followed by the S1 for sacral nerve root. L just stands for low back or lumbar nerve roots, and then the L4. So L5, S1, and L4 levels are most commonly affected. L4 not nearly as common. That's why I put it last. And these nerve levels give feeling to a specific area of the skin in the lower leg or foot. So they own a specific kind of real estate roughly in the leg. And we call these regions where these nerves supply feeling dermatomes. That's a fancy medical term for it. All right. So you can see here, right, that the L4, sorry, it's a little bit dull, but the L4 kind of goes down the side to the, right, the front of the thigh, maybe even to the knee, right, the inside of the knee and down to the inner ankle bone. All right, the L5 goes to the side of the knee and goes to the kind of the outer shin and then towards the big toe. So you say, hey, I'm feeling it down, my big toe feels a little numb or whatever. That's L5. And then the first sacral nerve root, S1, kind of goes down the back of the thigh to the back of the calf and then towards your little kind of pinky toe, the side of your foot. So let's test your ability to feel. So what I want you to do is I want you to lightly brush the skin of your outer lower leg on the right side, then the left side. So what you would do is you'd say, hey, let me kind of feel what this is like. And you compare that on the right side to the left side, all right? Then you want to do the inside, which we'll be testing. So that would be L5, compare one side to the other, right? And then you do the inside, kind of on the bony part of your shin, very lightly touch it. All right, so I was going a little rough out here. Very lightly touch it to see if you can sense what that feels like on the affected versus the non-affected or the good side, right? That's about L4 down to the inner ankle bone. And then finally, outside of your kind of foot to the pinky toe. So just very lightly brush from like your heel, stroke from the back to the front to the heel, from the heel to the piggy toe, the little toe. And that's going to assess, compared right to left, your ability to feel or the sensation of the S1, that first sacral nerve root. All right, so just do it very lightly, and you're trying to sense, is there a difference side to side? It's the exact same thing. If you were to come into my office or go to a neurologist, they would be doing this. They'd say, hey, close your eyes, and I'm going to touch here, one side, right, in the L4, L5, or S1 area, and I'm going to touch this side, and tell me, is there a difference, right? So, you know, if you have somebody to help you, you could have somebody else do this for you. Just teach them how to do this. And you will be assessing light touch or your ability to feel one side versus the other. Okay. So now, do both sides feel roughly the same or different? So if things feel the same on the affected compared to the non-affected side, then your feeling or sensory fibers are working just fine. And these are often the first to go because they're sort of towards the outer part of the nerve. So you're good to go if things felt the same. If things felt clearly different, dull, numb, or like you just can't feel it like you can on the other side, on the problem that's an issue, or on the side that's an issue, then it's likely you have or had some form of compression to the nerve and your nerve is unhealthy or was pinched at some point. There's something closing those lanes on the highway, if you want to think of it like that. So now let's check your strengths. We talked about how nerves send information such as feeling. We just did that with the light touch. Now we want to talk about this kind of movement component or the strength component. So the L4 nerve supplies the strength to the front of your thigh or the quad muscles, which helps you get up and out of a chair. The L5 nerve gives strength to your shin and big toe muscles, which allow you to pick up your foot and walk. The S1 nerve gives you strength to your calf muscles, which allow you to go up on your tippy toes. Right, so let's test out your strength, nerve root, kind of level by level, just as we did when testing your sensation. Take note of any weakness or differences in strength side to side. So here we go. So check me out up here, wherever I am in the video here for a second. You want to take your good leg, right? You can hold on to something if you want, and you can adjust the height of the chair if this is too difficult, but you're just trying to pick up one leg, take your good leg, and you're going to try to, again, a little help if you need it, you're going to try to stand up, okay, on the one side. And then what you're going to do is you're going to compare that to your other side, the bad leg, and try to, again, a little support if you need it, stand up. Okay, now you should just from one rep or so get an idea of, is there a difference side to side in your ability to use those quad muscles supplied by, plugged in from that L4 nerve? And if you need to do a bunch of reps, you can compare how many times you can do it on one side versus the other. But the idea is just to get a quick snapshot of, is there a clear difference side to side? So that's how you test the L4 nerve with a single leg sit to stand, good versus bad side. L5 test is super simple. I'm not even sure I need to show this, but the idea is you're down here and you're just walking on your toes. All right. You're just pulling your toes up. Took my shoes off so you can kind of see. And not on your toes. You're trying to walk on your heels because, again, the L5 nerve supplies that big toe, kind of initiates pulling your foot up, as well as the muscles on the front of your shin. So test that out. Walk around and see, is there a difference there? And then to test the first sacral nerve as far as the strength, you can do calf raises. So one way you could do this kind of functionally is you can walk on your tippy toes. So one way you could assess this, you could walk around and see, do you feel like one side drops and you can't do it? Or stand somewhere on the good side, count how many heel raises you can do. And on the bad side, you might notice if you have a pinched nerve, right, or some type of compression due to swelling or something structurally causing it, that you can't go up on that one side. So that would be a clear difference in strength side to side. So hopefully that makes sense. So again, is there a clear difference strength side to side? And look, if strength is equal on the affected compared to the non-affected, then your strength or motor fibers are working fine. You don't have a pinched nerve. You don't have an unhealthy nerve. So there's nothing pinching your nerve at all. If there was clearly a strength difference, then it's likely you have or had some form of compression of the nerve and your nerve is not as healthy as we would like it. So it's unhealthy at the moment. All right, so what if I've lost strength and some feeling, Dr. Charlie? What do I do? Do I need urgent surgery? So I bring this up again because a lot of people are like, oh no, like I can't go up my toe, right? Or I can't go up on my toes, or I can't, I noticed some difference there side to side. So good question. My best answer is this. Despite having loss of strength or feeling, most people still recover just fine without surgery. So as the body begins to heal and swelling is reduced within the nerve, compression is generally removed and the nerve begins to heal. So, something you might want to consider is just monitoring your strength and feeling on a weekly basis, right? So check it. Okay. How many calf raises can you do if that's what you're limited in, right? And then a week later, how many can you do now, right? You don't have to go crazy with it. You're just trying to see, are things moving in the right direction? Are you kind of stuck? Are they moving in the wrong direction, right? So if feeling and strength are slowly begin to return, it's a sign that your nerve is healing. You're heading in the right direction. Why would you change a positive trajectory, right? So if it's not, then surgery or other interventions, or maybe it's going the wrong way, you're getting weaker and weaker, then you might need something to decompress the nerve. All right, so look, there's little evidence suggests that any surgery for sciatica must be urgent. So a lot of people, before they try their things, they go to their doctor and like, man, you need surgery. I just had somebody yesterday reach out to me and said, hey, I chatted with somebody, a neurosurgeon, and they said, I need surgery. But they told me in their email, they're getting better. That doesn't make any sense. So there's another study that we looked at and essentially looked at the timing of surgery as it relates to, again, the number one cause, which is a disc problem as the cause of sciatica. And what they found is that while people who had surgery within 6 months, of showing signs of weakness and things like that, had better outcomes than those who waited longer, it wasn't really all that significant. And essentially, they felt that if at this point, time alone should not be the basis of recommending surgery. So the practice of telling patients that they need urgent surgery, right, for pain due to a disc problem, as well as function loss, has really no scientific basis. All right. So the other thing that a lot of people have questions about is this idea of like, if I don't have surgery, am I not going to regain my function? Like, do I need surgery to get back to life, basically? So there's not good evidence or clear supportive evidence that surgery to relieve sciatica is any better than natural treatment long term. Right? So again, this is good news if you want to heal naturally. So here in the British Medical Journal, they looked at conservative care, so natural treatment versus early surgery. You got to have this surgery in people with sciatica due to a disc herniation. And they looked at it over 2 years. And here's what they found. So you've got two lines here. You've got the blue line, which is kind of conservative exercise-based natural treatment. And then you got the red line, which is those who had surgery. And you can see basically on the left side is sort of the pain score. So 0 is low, 70 being very high in this, right? It probably went up to 100. But and then you have time. So 26 weeks is basically 6 months. You can see that's in the green. I circled that. In the pink, that's 1 year, 52 weeks or so, and 104, so 2 years. Again, that's circled in the yellow. And what does this chart really mean? So you can see that at that 6 months, that green circle, people are pretty much at the same pain levels for leg pain, back pain. So basically what this means is this. So studies show that surgery for sciatica does seem to result in quicker relief of leg pain than no surgery, right? So we look at that, right? So it looks like there's a quicker drop, but it's not really all that significant, maybe a little bit. So it does seem to result in quicker relief of leg pain than no surgery. However, outcomes are no better for back and leg pain or function at the 6 month, 1 and 2 year marks. All right. So in simple terms, studies show some evidence for quicker pain relief with surgery, but long-term, 6 months and onward, those who choose natural treatment do just as well as those who have surgery. And this is without the risk of surgery, right? So look, one instance where loss of feeling and strength would require urgent surgeries if you notice loss of feeling around your buttocks, your rectum, trouble with bowel or bladder movements. These are signs of something called cauda equina syndrome. And it's not common, but something to just be aware of. So let's summarize real quick. So here are signs you have like a pinch or unhealthy nerve. And again, it's not very common, but you would notice, you'd be able to assess without a test, a nerve test, an MRI, anything, you would be able to assess this just by using motion and or somebody feeling your legs, right? This idea of you will see some type of loss of function because the nerve, the lanes, some of the lanes on the highway on the nerve, right, that kind of house that feeling and movement signal. Those signals aren't going to be able to get to the target, right? Which is again to the skin, to the muscle, things like that. So you're going to notice a loss of strength. You're going to notice a loss of feeling. You might notice some changes in your ability to control your bowel or bladder function. Nerve tests, EMG, electromyography, right? Nerve conduction velocity, basically a test where they shock you if you've ever had this, and essentially what they're doing is they're racing signals down the nerve to see right to left which one goes quicker, if there's any slowing of the velocity or how quickly these nerve signals are firing. It's going to be positive. It's going to show that, hey, like you've got traffic jam somewhere along the nerve. And again, this would be kind of termed or consistent with like this pinched or compressed nerve type of dialogue. So how do you test if you have an unhealthy sciatic nerve? We just went through it. So this idea of light touch, you want to try it yourself, you can't get into those positions, totally understandable. Have somebody else watch this and do it for you. Muscle strength. So we talked about the sit to stand for L4, L5 heel walking, and S1 calf raises or toe walking. And then what do you do if you find that you have this? Well, you want to monitor strength and feeling week to week. So you do not stretch an already unhealthy nerve. You reduce oxygen to it. You'll make it more angry. Find positions and motions of comfort, yummy motions, and yummy positions. So this is the first type of sciatica. So a sciatic nerve that is unhealthy, where nerve signals are flowing at a slower rate than normal and is therefore experiencing loss of function, usually due to some type of compression. We talked about how to test it and some things to consider and keep an eye on. So now let's talk about the second type of sciatica. And this is sciatica that everyone thinks their nerve is pinched, but really this is usually what's happening. An angry sciatic nerve. So when you feel angry, does your body relax and move slower, or does your body go into high alert and your senses heighten? If you respond how most people do when they get angry, right? Your body goes into a fight or flight response. It becomes extra sensitive and extra reactive. So same thing with the sciatic nerve that is angry. So the second type of sciatica you could be dealing with is one where the nerve is not unhealthy or pinched, but rather just hot and bothered. So it's angry. In this case, there is no compression of the nerve, and the nerve is healthy, but aggravated. I'll explain to you what I mean. So again, if we think back to the analogy of your nerve as a highway, right? You've got all these lanes, everything's going in green, no traffic jams, lanes closures, anything like that. Feeling and strength are normal. Nerve conduction, those nerve tests look completely good. And now here's an angry nerve. Notice it looks exactly the same. So an angry nerve shows no signs of damage or compression or anything in the sense of slowing of nerve signals. So the nerve by definition is healthy, right? Nerve tests will be normal because there is no form of compression or pinching of the nerve. So then what the heck's going on? So because of this, there is no true loss of feeling or strength. And again, no MRI or nerve test needed because we can test the function of the nerve to see if it's unhealthy or just angry. By now, you should know if it's unhealthy because you've gone through the test for that. So again, for this, let's do the same thing. So feeling or sensation first. So this is the mapping, the real estate of where these sort of nerve roots, control or give feeling to on the skin. Let's test your ability to feel again. So have somebody else do it or do it yourself. Remember, lightly brush the skin on the outside of your lower leg, on the right and left sides. That's L5. Then on the inside, kind of your bony shin part, L4. And finally, outside of your foot from your heel to your piggy toe, your small little toe, right? And sense that, right compared to left. Do both sides feel roughly the same or different? Angry sciatic nerves will cause a heightened sense of feelings. This is important to differentiate. Skin will seem extra sensitive to touch. So for example, the brushing of your pants on your lower leg might feel uncomfortable. You may have said this to maybe your doctor or someone else, right? Like, man, it just feels like even just rubbing, anything it just rubs on it a little bit is irritating, right? It may feel like the sensation you get when you're sunburned, extra sensitive skin. So unhealthy nerves cause a loss of feeling. It feels dull, diminished. You poke it with a needle and you just can't feel it. So it feels less than the unaffected side versus this feels heightened, extra sensitive. It's an angry nerve. So let's check your strength. Just as we did when testing your sensation, note any weakness or differences side to side. Do your sit to stand test. I showed you earlier, go ahead and do it. Pause the video for a moment and do it. Now test L5. So that was L4, sit to stand, L5, heel walking. See how you do. Calf raises, go ahead and do it. So is there a clear difference in strength side to side? Remember that unhealthy nerves that are losing function show signs of muscle weakness with these tests because all the nerve signals are not getting to the muscle because of the sort of compression to the nerve. But an angry nerve is just angry. The nerve itself is completely healthy and therefore there is no strength or feeling loss. So let's summarize what we've learned about an angry, irritated sciatic nerve. Signs you have an angry nerve, gain of function. Remember, an unhealthy nerve has loss of function. This has a gain of function. The volume is turned up on the alarm system here, all right? There's normal strength, but there's extra sensitive feelings or heightened sensation. So there's no changes in bowel or bladder function, again, because the nerve control is fine. Nerve tests, so the EMG, the ones where they poke little needles, right? Nerve conduction, where they shock you, are normal, but they will often be very painful and will cause a flare-up if you're not careful. You could avoid it if you watch this video, but if you've been recommended, you go through it and you have this type of nerve, you will notice that things will be flared up for days, maybe a week. It's not uncommon to kind of have that experience because it's like poking needles into a sunburn, all right? So there's no pinching or nerve compression here. The nerve is just really ticked off and irritated. So how do you test? Same thing, light touch, muscle strength, things like that. And, just kind of your descriptor. Wow, extra sensitive to certain things, feelings, things rubbing on my skin, again, kind of light touchy, right? So what to do? Same thing as what you do with the other type of nerve, right? So do not stretch an angry nerve because again, you'll reduce blood supply and oxygen. Find positions and motions of comfort, yummy motions and yummy positions. Now, let's compare the two types of sort of sciatica, if you want to call it that, side by side. So again, unhealthy nerve, kind of got the X's over his eyeballs. Loss of function, loss of strength, loss of feeling, changes in bowel bladder function. The nerve tests, again, are going to be positive because they're going to pick up on the fact that some of the lanes are closed, as you can see there. This will be, again, termed like a pinched or compressed nerve, right? An angry nerve is going to be a gain of function. It's going to be normal strength, extra sensitive feelings, heightened sensations, no changes, bowel bladder function. The nerve tests are going to be very aggravating, but completely normal. And you're going to say, you know, hey, there's nothing wrong with you. There is, your nerve is sensitive, all right? But there's nothing damaged about it. There's nothing compressed about it, right? So there's no pinch or nerve compression. The nerve, again, is just angry. So now here's what's cool. Only in the rare instance or case that there is some form of strength or feeling loss that does not improve naturally, or bowel bladder function issues, the treatment for these cases remains exactly the same. Maybe not the same as far as what motions you do or whatnot, but natural, non-surgical in 97% of cases. So the focus of natural treatment is to optimize the healing environment, combined with finding motions that reduce pain and improve our ability to move and function. So remember this slide from the very beginning. Sciatica is a motion-based problem, can be reproduced with motion, right? And that's what I mean by motion-based problem. Can be reproduced with motion, can be made worse with motion. This is super important. More on this later. We are here. This is later, right? So thanks for hanging on in there. The reason this is so important is because your sciatica is reproducible with motion. 99% of cases of people who have sciatica, if it's true sciatica, will be reproduced by doing a certain motion, and this one specifically. All right. So it is almost always reducible with motion if it's reproducible with motion. So a problem that is reproducible with motion is almost always reducible with motion. We just have to find out what that motion or what those motions are that work for you. So think about it. Life is motion. Life is just a bunch of individual motions strung together in certain order or sequence, right? So you can move throughout your day. So if you have trouble doing this motion or any other motion, then your ability to live life will be limited or locked. So this leg raise, look up here. Hopefully you can see my little mouse, my little pointer. Kayak, well, that's just a leg raise. You doing this little yoga move or some abdominal hollow, if you do, I don't know, CrossFit or something, that's a leg raise. If I spin myself and I'm doing a down dog, that's a leg raise. If I'm running, yeah, no wonder you can't sprint or run or anything, because that's a leg raise in life. You can't even chill on the beach because you're in a leg raise. And if you want to play with your kids, do things outside, garden or whatever, that is a leg raise. So if the leg raise is on lockdown, you're not going to be able to do those things. All right. So now the only focus, the primary focus, the main focus of treatment is on fixing the leg raise and making it less yucky by optimizing how you live your life and your environment, being a detective, and by finding yummy motions that allow you to move with more ease. Then you unlock your ability to live life, right? So once you can unlock it, boom, you can make the leg raise better. Everything else naturally gets better along with it. So hopefully that makes sense, right? And if you can do that, then game over. That's it. You've won. You've figured it out. You've solved your sciatic problem. Okay, so key takeaways and nuggets, right? So folks with sciatica have yucky leg raises and other motions that show up in life certain ways that keep them from living life, right? Most sciatica is not caused by a pinched nerve. Usually the nerves are just angry. So erase those mental images and scary thoughts from your brain, right? They're not going to help you heal. Don't worry, be happy. There's a 97% chance you will not need surgery to correct this. Fix your yucky emotions. That's where you should focus, right? Fix your yucky emotions that are locking your ability to live life by optimizing your environment, again, being a detective in your life and finding motions that improve how your body moves, and game over. Again, you win the game. So instead of spending your time, energy, and money on expensive tests and other people to fix you, kind of problem-oriented, focus on solutions and learning how you can self-evaluate and fix yourself using motion. I do it every day. I've seen people in my programs do it every day. I know that you can too. So that is it. And here are some resources if you want to check them out of what I referred to, or references that I referred to in the video. So that's it, everyone. That's all I've got. That's what you need to know about sciatica. Again, there are many causes. You can check out my DIY guide. But at the end of the day, right, really cool, because it gets really complicated. Charlie's talking about like unhealthy nerves and angry nerves and this and that. You got to do the same thing. All right. At the end of the day, to solve the problem, you've got to optimize the environment for healing, right? Do some detective work, figure out what's nicking the scab and keeping it from healing. And then you've got to find motions to improve how you move. Reduce the sensitivity of your nervous system mentally and physically, using motion and or using other strategies on the mental mindset side of things. And hopefully this presentation puts your mind at ease as far as, again, sort of the cause of sciatica, and or what type you're dealing with and where you need to focus your efforts to get better. So hopefully it was helpful. Until next week, this is Dr. Charlie. Have a great one. We will chat soon.